Hello students. Now I am telling you about the oropharynx. It is the second part of the pharynx. The first one was the nasopharynx. Now second is the oropharynx. As the name suggests, it is against the oral cavity, so it is called the oropharynx. This is the diagrammatic presentation. Now you see the oral cavity. The anterior two-third of the tongue is the part of oral cavity and posterior one-third is the part of the oropharynx. So the posterior one-third of tongue is the floor of oropharynx or the base. The uvula and soft palate are the roof of the oropharynx. The palatine tonsils which are being seen here in the yellow color are the tonsils which generally we call the tonsils. These are present in the palate, soft palate. So these are called the palatine tonsils. And there is a arch which is the palatopharyngeal arch. Means this arch is present in the oropharynx and starts from the palate. This posterior one is the palatopharyngeal arch and the anterior one is the palatoglossal. The palatoglossal has the end at the gloss or at the posterior one third of the tongue, lateral part, and the palatopharyngeal is merges with the pharyngeal muscles. These mucosal folds are containing the muscles palatopharyngeus and the palatoglossal. These are the arches and these are also called the fascias or the pillars as the anterior and posterior pillars which are embedding the tonsils or the palatine tonsils on the both sides. So, oropharynx behind the oral cavity extends from the plane of hard palate above to the plane of hyoid bone below and communicates anteriorly with the oral cavity, superiorly with the nasopharynx and inferiorly with the laryngopharynx. Boundaries: posterior wall, rectopharyngeal space. As I have already told you, the posterior wall is common of the nasopharynx from the base of skull up to the C6 vertebrae. That is the posterior pharyngeal wall. It has layers and posterior pharyngeal wall is present in the nasopharynx, in the oropharynx and in the laryngopharynx. Anteriorly, it is communicating or it has the boundary with the oral cavity with the oropharyngeal isthmus. Oropharyngeal isthmus means that part, that narrowing that is dividing the pharyngeal part of the oropharynx and to the oral cavity. That is the oropharyngeal isthmus. Floor that is set already base of tongue with the overlying lingual tonsils. The lingual tonsils are in the tongue. So these are called the lingual tonsils. Palatine tonsils are in the palate or in the soft palate. So they are called the palatine tonsils. These are the lingual tonsils and already said they are the nasopharyngeal tonsils because they were present in the nasopharynx. So the name according to the areas where these are present. And next is the valleculae. Valleculae are the structures after the base of the tongue. If you see your tongue, posteriorly there are projections. These are the tonsils called the lingual tonsils. After that, there are cup-like structures on the two sides of the base of tongue. These are called the valleculae. The lateral wall of the oropharynx is, as already said, the pillars, fascias are the palatoglossal and palatopharyngeal arches and roof, soft palate and nasopharyngeal isthmus. So there are two isthmus, there are two narrowings, one is the oropharyngeal and other is the nasopharyngeal isthmus. These are the boundaries. Now look at the picture. Above this is soft palate and after the soft palate, with the soft palate ends, there is the oropharyngeal isthmus and the palatoglossal arch, palatopharyngeal arch, palatine tonsils, lingual tonsils, and these lingual tonsils are present in the posterior one third of the tongue. So total tongue is not the part of oral cavity. Anterior two third is the part of oral cavity and posterior one third is the part of the oropharynx. Now come to the palatine tonsils or the tonsils which are present in between the two arches, anterior and posterior arches of the palate, and these tonsils are two in number. They are white masses of lymphoid tissue which works for the defense, and they are present in the gate of the digestive tract or in the airway. So they protect the lower respiratory and the gastric tract, and they are active at the time of infancy and childhood, because in that period the children do not have the immunity, so they protect, and sometimes they become enlarged. They are situated in the lateral wall, and they have two surfaces, the one surface medially which is towards the midline of the body, and lateral which cannot be seen, has two poles, upper pole and lower pole, and it is having the tube like invaginations, means these are having channels. So, and in the medial surface these channels are closed by an epithelium, but otherwise these channels are called crypts. One is the major crypt and other are small crypts, and these crypts, when once there is infection or inflammation in the tonsillar mass, the epithelium erodes and these crypts become open, and when these crypts become open, these become the residence for the bacteria, because these are channel like structures, and they become the residence for the bacteria once the crypts are ruptured in the course of infection. There is also a sulcus, tonsillolingual sulcus, which separates the tonsillar mass from the tongue. When we project out our tongue, there is when the tonsil ends, where the tonsil ends and it meets with the base of tongue, that region is called the tonsillolingual sulcus, and it is a common site for the carcinomas, which are sometimes not seen or not examined properly and may become hidden. Lateral surface of tonsil, which is I am telling you that it is not visible, but it is covered by a fibrous capsule, and this capsule is loose, and at the time of surgery of the tonsils, where the tonsillectomy is done, the tonsils are separated from this capsule, which is a loose structure, and these the tonsils are being removed from this area. The bed of tonsil. Bed of tonsil means the tonsil which we are seeing when we open the oral cavity. Then we see the structures that are the tonsils. And the bed is not seen, but bed is containing the very vital structures which should be kept in mind at the time of the tonsillectomy. And if there is any tonsillar infection, like if there is any abscess formation in the tonsillar mass, this infection may cross and may reach up to these vital structures, and if there is any abnormality in the function of these structures present in the bed of tonsil, it means the condition is somewhat critical and complicated. So, on the bed of tonsil contains from the medial to the lateral, from the inner side to the outermost side, that is superior constrictor muscle, glossopharyngeal nerve, which is a cranial nerve, styloglossus muscle, facial artery, submandibular salivary gland, medial pterygoid muscle, and the angle of mandible, which is the outermost part, angle of mandible. This is the bed of tonsil. Now look at the picture. There are seen the invaginations in the medial surface. These are the crypts, and there is crypta magna in the above part, which is the intratonsillar cleft, and other are the tonsillar cleft, small clefts are there, and the lateral surface is demarcated as the green, and there is the bed of the tonsil, which is seen as the capsule is there, paratonsillar vein is there, pharyngobasilar fascia is there, and the mandible is there, facial artery is there, glossopharyngeal nerve is demarcated. These are the surrounding structures of the tonsil. These are having the clinical importance in the time of surgery or in the time of infection of tonsil. You are seeing the facial arteries invading the tonsillar tissue, and when tonsillectomy is done, there is a bleeding, there is a complication of the bleeding of the this facial artery, and there may be thrombosis and late complication as the massive bleeding may be there, and The infection may pass through this capsule and reach up to the superficial surface or near to the mandible also. So the importance of tonsillar bed is there. Blood supply of parental tonsils only for the purpose that if there is tonsillectomy done and bleeding is there, these structures, these arteries are to be kept in mind so that ligation can be timely done, and these all are the branches of external carotid artery. Look at this picture. There is a crypta magna. There are crypts, small crypts, primary crypts, secondary crypts. If these are lined by the epithelium, if this epithelium may rupture, when it is ruptured during the course of infections, chronic infections, repeated infections, this epithelium erodes and these crypts enlarge and they become open. And when they become open, they form the large tubules, and there is the bacteria get the site for residence, and the food particles are also impacted, or food particles are deposited over these crypts, open channels, open tunnels, and they become the source of infection. There is a chronic tonsillitis. So if this condition happens and continuously happens, then there is a need of removal of this tonsil, because in this stage of hypertrophy it is not of now functional, because the function is of defense, and to meet the defense function it has become enlarged. No, it has to be removed if it is a nidus for the organisms. Lymphatic drainage is again important. Jugulodigestic lymph nodes. Jugulodigestic lymph nodes again drain the tonsils. These are generally enlarged, these are generally inflamed. In children, they are felt, they are palpable because they are almost enlarged, and these are seen at the angle of the mandible, jugulodigestic, and so they are also called the tonsillar lymph nodes. Nerve supply, it is having the sensory nerve supply from the trigeminal branches, glossopharyngeal nerve. Now the function of oropharynx, as it is said earlier that it has the major role for the defense, and it is the passage for air. Sometimes we have to take the mouth breathing through this. The air goes into the lower respiratory tract, and it is the structure oropharynx is important for the swallowing, and it helps in the identification of taste, because besides the taste buds present in the tongue, these are also present in the soft palate and base of tongue and posterior pharyngeal wall. I think you can understand what is the posterior pharyngeal wall in the oropharynx.